My name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Deanna Orfanidis, NMC's Chief Nursing Officer, and Tayler Levesque, who is a nurse at NMC's Emergency Department. So we're going to be discussing NMC's new system of clinical practice governance. And so I'm excited to have you both here. So thank you for joining me.
Thank you, Jill.
Yes. So Deanna, you have been on. You haven't been here too long, so I'm sure people have all seen our first broadcast with you introducing you. But so let's start off by you reintroducing yourself, and then Tayler, it'd be great to know a little bit more about you, and then we'll dive into our topic today.
Yes, thank you, Jill. So glad to be here to talk about such an important topic as clinical practice governance. So I have been here 3 months and really have participated with nursing across all of NMC in really beginning to develop our model of clinical practice governance. It's been a great journey. We're really excited to be doing this work together.
That's terrific. Thank you.
Yeah.
Good morning, Tayler.
Good morning. It's lovely to be here. And I am a nurse in the emergency department. I've been there for 3 years now. I've been a nurse for 6 years. I worked at 2 different hospitals, previously all in cardiac, so medical cardiology and then surgical cardiology after that. And then I absolutely love the emergency department. Yeah.
That's terrific. Thank you so much.
Fantastic background.
It is. So why don't we tell our viewers a little bit, what is clinical practice governance?
Sure. So clinical practice governance is likely a more contemporary description of what had been previously known as shared governance. Although it is within the umbrella, there are words that are interchangeable: clinical practice governance, shared decision making, collaborative practice. But at NMC, with our staff advisory group, we made a decision to talk and describe our model using the language clinical practice governance. But when you think about what it is, it's really uniting nurses or other disciplines, because you can move to an intraprofessional model in the care that they're delivering for our patients and families. And it's the way we practice and deliver care to meet quality outcomes, patient-family experience, and then employee engagement. And most importantly, with with our model really around nursing engagement.
I know that as a part of the advisory council, we were really wanting to include not just nurses, but also to include other members of the bedside care team, so LNAs, MAs, techs, all the different perspectives of people who are providing care. And like Deanna said, it is primarily nurses, but we really want to involve the whole team who's taking care of the patient at the bedside.
Now, speaking about the care of the patient at the bedside, what do you see as the benefit to the patient?
Well, I think that it's going to be really engaging the entire Northwestern team who is providing care at the bedside. It's going to be engaging all of us bedside caregivers to be on the same page about initiatives. I think it's going to really result in a more unified approach to patient care and really improve knowledge of the patient experience in the many different departments that Northwestern has, like the outpatient clinics and the inpatient side.
Interesting.
Yeah.
Interesting.
Yeah, and I could add, when we think about, for example, as we do our work together around achieving excellence in care, we would really partner as a clinical practice governance council and participate in, the decisions that need to be made around practice and evidence-based practice with the most recent literature. Those decisions will be made together with administration, myself as the chief nursing officer and formal leadership, to provide the best care for our patients. So one example would be, for example, hand hygiene. That is one initiative that we really want to partner with our patients and families and incorporate them into, hey, we really want to be great around infection prevention. So it's the point of care, in the literature and some of my experience, 90% of those decisions really need to be made with the people doing the work. So having our clinical nurses, our environmental services, really understanding and partnering with our patients to help us be the best we can possibly be.
Wow.
And so that truly is, and as Tayler alluded to, we're really thinking about uniting nurses and professionals across the continuum, no matter where you practice. So if you're in Georgia, we're incorporating those folks in defining and being the best we can be, achieving our quality outcomes.
That sounds very, very interesting. And I think about this past year, for nursing, we've seen quite a bit of change. And so how do you think this will benefit nurses and nursing, the profession of nursing at Northwestern?
Well, I think that there is a tremendous amount of energy and enthusiasm and interest in from the nurses to be more involved in developing the care that we're giving to patients, to be guiding best practices, and to be directly involved in, partnering with hospital initiatives, partnering with leadership to be bringing all that to direct care at the bedside, and to be really feeling like there's a robust back and forth conversation where there is a huge opportunity for us to be, improving how we're taking care of members of our community, to be directly involved in the decision-making process around what we're implementing and how we're implementing it.
It's so exciting. It sounds like nurses are finding their voice and feeling as valued members at the table to be involved in decision-making and setting priorities around their care that they're providing their patients.
Yeah, absolutely. They're, very passionate. Very passionate.
I can feel it.
Yeah.
I love that. Yeah, I think that's great. So when you, to describe the model, so what is the model, what does it actually look like? I feel it. Now, what does it look like?
Sure. And I would add that it's been really inspiring for me as the chief nursing officer working with our staff advisory group, which is a group of nurses coming together from all parts of the hospital and working with myself on, okay, what does this thing look like? And we've had many retreats and hours working together, and through the design team, we came together and really decided that, we're going to start small, keep it simple so that we can learn, and then we'll add. Sure. So currently, our model is that at the center of our care, and Tayler was really instrumental in really reminding that we're here for the NMC family, all the employees of Northwestern Medical Center, and also our patients and our community. So we ground ourselves in that. That's our, so to speak, our mission. And then around that, each clinical area will begin to actually vote and nominate the councils, which would be unit-based councils. So the emergency department, surgical services, ambulatory services, and around that, each chair of those local councils will have a seat on what we are calling the coordinating council. And the coordinating council is your highest decision-making body. So there are things in locus of control related to your unit-based council, but some of the big things. So for example, if we were going to work on a professional development model, how nurses progress progress through their career related to that. It would be, yes, you would have input from your council. However, the coordinating council would really be the approving body on the final professional advancement career plan or such. So, and then in the future, as we begin our journey, that's our first. We're in kind of a draft.
Yeah.
Want to get started.
Yeah.
Because Tayler and the advisory remind me that people want to get going. So I was like, okay, and it's not going to be perfect. And then I see in the future we'll add likely hospital organizational, for example, a quality and safety council that would be really more focused on the work across wherever, not just at your unit, or professional development or clinical practice. So it'll evolve, and that's fine. Just having had experience, you start and it eventually, you learn and you add and you tweak.
Yeah. And all the outpatient clinics, there's the unit-based councils also include one for the primary care offices and the specialty clinics. So they're also going to be brought into that conversation, which is really important.
Because we have nurses in many different areas, so it's wonderful that you're bringing it all together. And so when you were talking about that consistency, that it creates that by bringing everybody to the table so that everybody feels included as nurses. That's so where are you at in this process? You talked about councils and selecting council members and things. So where are we at in this process at this time?
At the time this airs, we're going to be in the midst of our elections, which is really exciting.
Okay.
So we are really excited about getting the ball actually started to have the unit councils and the coordinating council come together with the first members. Yeah.
So the folks that helped get it together, it sounds like, Deanna, you had nurses in advisory capacity helping to design this. So are those nurses already going to be on those councils, or is there a possibility that you've done all this work to develop it and you might not be on a council? I couldn't imagine that.
No, I know that was one thing when we first joined and came together. I said, so our staff advisory group is a design team, and the work of the design team comes together, and then that group disbands. Yeah. However, I'm hopeful and confident that each design team member will have a spot and a place within the structure. But it is a nomination and an election process.
Yeah, and there's already been some involvement from the members of each department in even determining what the exact composition of their unit council is going to be. So we many months ago sent out a survey, and so people on each of those departments were able to choose who they think would best represent them. So, in each council, the majority is nurses, but they also were able to say that they wanted emergency department techs, and our unit secretary will be on the emergency department's unit council.
Nice.
And of course, for the outpatient clinics, the MAs are super important. And so it's going to be more equal between nurses and MAs on that unit council. So each of the unit councils is going to be really focused on addressing the specific needs of their unit, of looking at how they are practicing, but then also sending their chair to the coordinating council will really kind of tie in kind of the hospital-wide discussion of what our goals and initiatives are to that direct bedside care through the unit-based councils.
Wow. I feel your energy. It's igniting me. I love it. It's like, so we're really reigniting the passion and the voice for nursing, aren't we? I mean, in the care of the patients, which everybody is so committed to provide that best patient care. Okay, so let's fast forward. I know our time is getting short, but let's fast forward and think, or a year from now, we're sitting here. what's different? What do you want this to feel and look like? What do you want? Is there something you want to accomplish? I know you say you want to get going, start small, but if we're sitting here a year from now, what do you want for nursing?
Well, I think that just having there be a sense that there is a clear channel for if you have an idea or you're interested in some new initiative that's going on, that you have a clear channel for bringing that to fruition in your department, for making that positive change, that there is a path that there is a group of people you can always go to with your ideas to have a specific way to implement change.
Yes.
Yeah. I think it's going to be really great. I think there's a lot of excitement. I think people are very passionate and have lots of ideas, are interested in always improving our care. And I think it's going to be a great pathway to make that successful.
Oh, gosh. Warms my heart.
Yes.
And what about Deanna? I mean, you come in and you're here 90 days and you've got this big, this is what a great way to get to know your nurses and to develop something new together. So what do you hope for a year from now?
Yeah, I think that's a fantastic question. But when I think about a year from now is really having the foundation to build on and having that bi-directional communication between nursing, the team, and formal leadership and administration, and impacting the care that we're delivering our patients and families. And I think about, I know Tayler and I and the staff advisory, like really excited after the new year. Let's get going on our nursing strategic plan. So, there's a lot of a lot of energy in which we have a lot of work. And we always think about, okay, who can we bring to speak to us about their success and their journey? So we have some good presenters and folks plan to keep the inspiration going. So
That's fantastic.
I'm just so grateful to have such a great team of nurses, LNAs, MAs, and folks to begin. And also, Jill, your support as a CEO in giving us the permission to have the time to do this very important work.
Yeah.
Thank you.
Oh, it's my pleasure. It's totally what I wish for nursing, that they feel so proud about their nursing practice and that they have a say. You have a say in the direction and in the care that we're providing to our patients. So I appreciate that greatly. Thank you both for your efforts and for the advisory group and everybody that is so involved in this to make this possible. So thank you. We got to go, but you got to come back. And I'm just thinking about the studio and how many nurses and support we can fit in this room when we come back and we celebrate. Because don't forget to celebrate along the way, because as you know, it can be all over the place, but come back to your core.
Thank you.
Because it's important work. So thank you both very much.
Thank you for having me.
And I'm Jill Berry Bowen, CEO of Northwestern Medical Center. And it has been such a pleasure to be with you today to talk about, clinical practice governance and what it means for nurses. And I think for recruitment and retention, I think this is powerful, but also in the amazing care you'll receive at Northwestern Medical Center. Thank you.